So as promised, we are now here in the Home Health and Mobility Department at Young's Pharmacy with this beautiful woman who is actually the mobility consultant, Brenda Petrusa. How are you?
I'm great. Great to have you here today.
You know what? What a day it's been. The first ever REMS bone scan in a pharmacy in Canada. The Osteosound REMS bone scan had a clinic here in the morning, but it just felt like the right place to be because I gotta tell you, this store, this department has meant a lot to me personally. Why? Because you've helped so many of my family, my friends, my patients. And it seemed fitting that if we were gonna roll in the REMS, into a community pharmacy, that it would be here at Young's, and talking to somebody like you that's so passionate and has years of experience. Tell us about Young's and this particular department and the incredible offering that you have to the community.
And that, well, we're here to help the community any way we can. We want to keep people in their homes longer or help them in whatever setting they're in at that time of life. So families come in, the children of the parents come into the Young's not really knowing what they want, so we'll guide through and what programs are out there to help them. And
oh my gosh, did you hear what she just said? And you don't get this often. The overwhelm and the confusion and the fear when somebody is going through something and they're not sure, as a family member, maybe you have an aging parent, or and it can be really debilitating and hard.
Overwhelming.
It is overwhelming. And what you just said, not only are you here, and we're going to talk about all the aids and falls and fracture prevention and safety, but what you said, which was more important, is the care.
Yes.
It's the taking care of people, the listening, the hand-holding, the one-on-one connection, which our society is so missing. And at the heartbeat of this place, not just this community, but this pharmacy, that's what I have felt, and you said it so brilliantly there.
Oh, thank you.
It's really important, isn't it?
That it is, and we do care about the end user, the client.
Right.
And that.
And you go out into the community. I know that you've gone into seniors' homes.
We go into all senior homes, into people's actual homes to help them.
Amazing.
And that.
So when you go into, let's say you go into a senior's home, let's give a shout out to a local home like Mountain View Residence. I'm sure you visited there.
We're in Mountain View all the time.
Yeah, or Amica, or any of Edgewater, or any of the ones that are here. Tell us what you do when you go into those facilities, and how is that helping both the residents, but also the care teams?
So we go in different ways. Sometimes we'll go there and we'll do an actual show. So anything that we have on the floor here, we bring with us.
Wow.
So we try it in their home. So they know what it's like to drive a power chair, try a rollator, so in their environment. And
Amazing.
It makes such the difference. You can try it in our store as well. It doesn't have the same effect.
That's so true.
And that, can you get through your doorways? Is it too wide? Is it too narrow? And that, so we'll bring that equipment. I'm in the homes all the time, so with PTs, OTs, using the government program, assisted device program, so that 75 is paid by the government, you would pay 25. So as simple as having a rollator to help you get around, not necessarily a piece of equipment, but think of it as an exercise equipment.
Yes.
So now you can walk longer, feel more confident.
And do it safely.
Safely, that is our main goal.
The massage therapist and kinesiologist in me, that's music to my ears, because yes, we want people to be safe, but we want them to have a health span, move it or lose it, but done in a safe way. We don't want you just sitting, becoming a couch potato because you feel unsafe. These things, as you so beautifully said, they act as a tool and an exercise aid, equipment, which is incredible.
Yes.
Yeah. Also, I think some of the, the homes that you go into in terms of retirement homes, it's got to be great for their healthcare teams to know that they've got a local pharmacy that's helping the residents in terms of their safety and their care within their facility.
And we work closely with them. All the homes here, we work closely with them. We're here to support them.
I love that.
And that.
So I get really excited when we can actually show what you can do. How can we help? And so what better place than to take us on a bit of a tour than here at Young's. So of course, a lot of people are going to recognize things like this, the rollator. But can you talk a little bit about what these are? This one's a rollator.
This one's a rollator here.
Yep.
This one is great. And they come in 3 different seat heights, sorry.
Seat heights, yeah.
Yes, 3 different sizes. So we will make sure that you get matched up with the right one for your body type, so that you aren't, having a really low seat and having to work to get up from it. And it's just a tool. So you can rest on it and have a place that is safe to sit.
Yes.
But when you get the energy, you can get back up and move smoothly.
Absolutely. And I love the fact that you are looking at the individual person, ergonomics, and making sure that it's safe for the individual. You're not using the neighbor's rollator that you're trying to retrofit.
And we get people all the time. I'm going to just use my dad's. I'll just use my mom's, or I have this one. The brakes don't work so well.
Yeah, no.
We want to make sure that you have a safe piece of equipment for yourself.
Absolutely. Then, of course, is that a transfer chair, or what is this chair here?
This here is a stationary or a wheel commode, but this is a transfer chair.
That's what I meant, yeah.
So I consider this a people mover to get you from A to B. Say you have to go to the hospital and it's that great big long walk, it gets you there safely. So that's what this is for.
Amazing.
And
then you've got the Cadillac down there, which is a
what are we looking at, Deb?
We're looking at the power.
Oh, we got lots of power.
Yeah.
On that.
So tell us about this.
We have a lot of power chairs, and the cool thing about these power chairs is they fold, so they can go in the trunk of your car.
Amazing.
So you can get out and do the places that you want to go. You want to go to Canada's Wonderland with the grandkids for the day, but you just don't have the stamina to go all day long. You can take this. It's a tool.
You know what I love about what you're saying is how it's being integrated into life and allowing people to live with health span, not just lifespan.
Yeah.
Just because you may have more mobility issues, or perhaps you have a fear of falling because we don't want you to fracture.
No.
But being isolated at home is not good for anybody's mental or physical well-being.
Absolutely.
The way you just integrated that and it's showing how this can be folded up and actually so you can still be part of your family's lives and live to the best of your ability is so important at any age.
At any age.
Now, one of the things I know to be very true is the bathroom can be a very dangerous place, especially if somebody has osteoporosis, or more importantly, as you're learning from this show, poor bone quality and having a high fragility score. Falls in the bathroom can have massive consequences. So things like the grab bar.
The grab bars, to have those installed properly into a stud so they don't pull out from the wall and you have another fall.
Exactly.
And there's placements where you should, so you can contact your OT and they'll tell you where to place them in the washroom that's safe and where they should be, or even just having as simple as a bath chair to have a shower and feel safe while you're having a shower. Somewhere to sit.
Still a bit of independence, but also safety first, always. I know this has been used in our family for many occasions, whether it's been a hip replacement or somebody has fractured or they're recovering from surgery, a raised toilet seat. Tell us about that.
Just makes it raises up the toilet so it's easier to get on and off the toilet. This one actually has bars so you can use that to lower yourself, and it just makes it easier.
Yes.
And that if you have a sore hip, sore back, these are a lifesaver.
Yes.
And that.
Yes. Now, you know, over here, we got to walk over here. These lift chairs, which I am very well aware of. My father, you guys were great, and I got one of these for my dad, who's no longer with us. But as you can see, it's lifting up. So let's talk about this.
Great piece of equipment to use in the home that if, excuse me, if they don't have the ability, excuse me, to get up and out of the chair anymore.
Absolutely. And what I want to say as a therapist, because we know that loss of muscle, sarcopenia, is really not good for bone health. We want to make sure we're doing resisted exercises. So we don't want to rely on a chair like this and never use our muscles, because losing muscle means you lose bone, and losing bone makes you fragile. So use the chair, of course, to keep you safe, but also use those muscles to get up out of the chair, and even doing things like this where you're seated and then you're standing, and you're seated and then you're standing.
Correct.
And then you can lower it a little bit as you get better, with assistance, with your therapist. But that's what I love when you're using this as a tool for safety, but also as a way to help you stay mobile and fit to the best of your ability.
Right. Yeah. And to stay in your home just that little bit longer.
Absolutely, absolutely. Now, I know that you have also done in the past falls and fracture prevention.
Correct.
like workshops or seminars. Tell us a little bit about that.
So we'll go out to like the seniors home here in town, and we'll just have a group, and I'll bring an OT with me, and we'll just talk about it. Ways that they can stay in home longer to prevent falls.
Right.
I had a great lady who, no one wants to get a piece of equipment. No one wants to come get this. And she just talked about how with a rollator, she can now go for walks, now can have a better life. And it's the people there that actually make it, because they're the ones that are promoting my product. I don't have to do it.
You don't have to do it, exactly.
Absolutely.
Now, one of the things I also love to talk about, and we have to when we're talking about falls and fracture, especially with an aging population, and that is the lack of proprioception and balance as we age. You know, balance we take for granted when we're young, but as we age, we lose proprioception. But it's sneaky. We don't always know we're losing it. And often we find out once we're on the ground.
Absolutely.
But here's the good news. You can train balance, you can train proprioception by doing things safely. Standing on one foot, for example, by a countertop, and making sure that you can stand on one foot. You'll often hear me speak about the spike mat, and that is an inexpensive tool that you can be using. Not only does it feel great, but it helps with proprioception and challenging your balance. It helps with pain, and it's something that can be, whether you sit, stand, or lie on spike, it can help reduce falls and fractures. It can help reduce pain. And I love it because it's in my kitchen, and I know my 82-year-old mom, Mary, I'm going to give her a shout out. She stands on her spike mat, brushes her teeth with one hand, and actually at her countertop, because she wants to be safe, does her 1 foot balance using the spike mat. And she's 82. And this is the thing.
I think we need to bring spike mats.
You do. In fact, you do. And what's cool about it, it's a Canadian inventor who I know. It's a Canadian company. And it's a brilliant technology, and it's accessible. And a lot of extended health insurance companies will pay for it, which is amazing. Let's finally speak to that. Do you help facilitate, if someone, you talked about the different programs to assist with paying for some of these things. Can you speak a little bit to that?
A little bit about the program that we use is the assisted device program. So you would need to get an authorized OT, which we have ones in the community we work with. They don't work for us. We could hook you up with those and walk you through the program.
Amazing. And some extended health insurance companies do cover things, whether it be, you know, a rental.
Absolutely.
You know, if it's going to keep you safe after surgery or what have you. So there's lots of ways to help you become the CEO of your health. Brenda, was it that hard to do a segment with me here at Young's Pharmacy?
All good.
It has been such a fun day here at our local pharmacy, the first ever Osteosound REMS bone scan at a pharmacy across Canada, and I can't think of a better place than in my neighborhood, my community, my pharmacy, Young's Pharmacy. Brenda, thanks to you.
No, thank you.
Thanks to Peter and Jamie and the entire team here at Young's. I got goosebumps because this has been a long time coming, and to all of the patients that came here today to have their scan, we want to thank you. And if you want more information about the REMS bone scan, or about any of these aids, or about how we can stock your preventative health toolbox, you got to stick around at PHAMCAST. Follow us online, famhub.ca. Check out our blog, and be sure to reach out to us and tell us the types of information you want to learn about, because we might be coming to a community near you soon. So on behalf of everybody here at Young's, we cannot wait to see you soon.